This is a 5-minute update. Health news. Hibiscus tea may lower blood pressure up to 13%. According to a report in the trade publication Pharmaceutical Technology, subjects that drank hibiscus tea daily were able to lower their blood pressure compared to the placebo counterparts. Diane L. McKay, a nutritionist at the Antioxidants Research Laboratory at the Jean Mayer USDA Human Nutrition Research Center on Aging, said daily consumption of 3 cups of hibiscus tea, an amount readily incorporated into the diet, lowers blood pressure in pre- and mildly hypertensive adults and may be proved to be effective components of the dietary changes recommended for people at risk of developing hypertension. Risk factors for atrial fibrillation. Researchers have identified risk factors associated with atrial fibrillation. They hope that the information may be used to help prevent the disease in the future by providing heart patients with a risk score. The risk factors identified are older age, being male, being overweight, hypertensive, having a heart murmur, and a history of heart failure. While the risk factors have been looked at individually in the past, this new finding may help develop a scoring system. Lead researcher Dr. Emilia Benjamin, professor of medicine and epidemiology at Boston University School of Medicine, said, "We know a lot about prevention of many different types of vascular disease, but there has been very little attention paid to preventing atrial fibrillation. Atrial fibrillation can be treated with either medication or surgery. It is the most common form of arrhythmia in the United States and affects 2.2 million Americans. Dialysis patients benefit from lowering blood pressure. Lowering the blood pressure of dialysis patients can reduce the risk of death from cardiovascular disease. Kidney dialysis patients tend to have higher blood pressure and are at a higher risk for dying from heart disease. After evaluating data from 8 studies, Australian researchers concluded that controlling blood pressure may reduce the risk of heart attack and stroke. Vlado Perkovic of the George Institute in Sydney said, risk of cardiovascular events such as heart attack or stroke is 29% lower in people with lower blood pressure than the control group. They found that lowering blood pressure significantly reduced the rate of death in dialysis patients. They concluded that blood pressure lowering treatment should be routinely considered for individuals undergoing dialysis to protect patients from heart rate or cardiovascular disease, such as heart attack and stroke. This will reduce the risk of dying. This has been a 5-minute update. Health news. Please subscribe to our videos.
Remember to subscribe to our YouTube channel.